Hi everyone, this is going to be staying organized as a new grad in the ER. Today we're going to be talking about the brain, how to make a brain, and how to use it. So before we get started, what is a brain? So essentially a brain is going to be a white piece of paper that you fold into multiple sections. In each section is going to correspond to a specific patient. In this section, we'll have exactly what we have here on screen. It's going to have the chief complaint, the history, the home meds, the assessments. It's going to have what's pending for your patient, the labs of your patient, important things like allergies, folk code, and the patient label. And this on screen is a basic way to stay organized with each patient, to know what's pending so you can stay ahead of it, to know their home meds off the super quick, to know their chief complaint, to know their history. Throughout the day, there's going to be a high turnover. So having this simple format will just help you stay organized and help you stay in your A game throughout the day. As far as labs, super quick, I want to note that you should start doing your labs like this and kind of memorize what each lab value is for on each little section. A lot of the times it's just universal. So if you go from one facility to another, you can just kind of take this over, and it's just a way to stay organized with your labs as well. So this is going to be an example of how to use this. So at the top, as we said, we're going to have our chief complaint. And just noting this is something you're going to write into the white piece of paper. So it will be chest pain and shortness of breath times 2 hours. Their history, or write it super quick under diabetes, high blood pressure, PE, IVC filter. What are the meds? Metformin, Norvasc, Coumadin, and then as far as assessment, you want to know things that are out of the ordinary, right? So 7 out of 10 chest pain, mid-sternal, non-radiating, worsens with inhalation, your heart rate is 117, patient's diaphoretic and anxious. You will write it super quick little notes so that when you go back to chart after you do all the interventions for your patient, you have there the necessary things that you want to put in your chart. And then very importantly, I want you to put in red what's pending for your patient. So CTHS, a chest x-ray, and it needs to be in red so that you know those are the things that are important that must be done. So you stay ahead of the game, that you're calling CT, that you're calling x-ray for these things to be done. Other important things are going to be like allergies and folk code. And as I said in my first video, you should get a multicolored pen so that you can do things in different colors. So important things in red. In labs, I like to keep it in blue. In pertinent critical labs, circle them in red. So down here is our labs. And then put it into this patient that came in with chest pain and shortness of breath. You know, their dimer is important. Something that I should have put here is like a troponin level. How's that? You know, and if it's elevated, circling it in red and setting treatment options in play. And then, so this is just a simple way to stay organized throughout the day, especially if you're an ER that has a high turnover. You're going to be ranking through patients on a consistent basis. So staying organized like this would be perfect for you. And then if once you start seeing more critical patients, obviously this is going to be a little longer. You know, you're going to keep track of which pressors you use, what's the urine output, which for example, if a patient's a DKA patient, you're keeping track of their sugars, their insulins, their bicar, their BNP, all that good stuff, right? But for your simple patient that just got there, this is a good way to keep it organized. And then if you want to help support the channel, just go ahead and over to Etsy and check out the merchandise that we have. And as always, teamwork makes the dream work, guys.